think, looking at the overall structure of your face in conjunction with the symptoms you were describing and the trouble sleeping, I do think that combined with your headaches, especially, you know, the tenderness around the temporal region here where you're getting some of that tension, and behind the eyes, that orbital discomfort, I think the weighted mask would be a really good fit for you. I think, let's see, I just want to see the shadow here. That looks okay. I'm going to take a couple of measurements, Maddie. I'm going to measure just kind of the base length of the eye so that I can adjust the weighted mask accordingly. So we're going to fit it to your exact specifications. All of Manta Sleep's masks are entirely customizable to your body and your needs. This one specifically, I'm going to adjust the eye cups to ensure that we get the most comfortable fit for you. So we're about 1.5 on the right side, so I will adjust for about a 1/4 inch difference there, and then just at the bridge of the nose, about 3/4 inch there. Right, that looks okay. Now have you open your eyes wide for me for just a second there, Maddie. I'm just gonna measure overall width of the eye. We're at about 1. Let's see if there's any asymmetry that needs to be accounted for, but that looks okay. All right, you can go ahead and relax there, dear. That's good. Okay. Now, we talked about the symptoms that you've been experiencing, and you mentioned that you typically like aromatherapy and you have a preference for eucalyptus. So I've kept that in mind today. I have an accessory that I want to try with your weighted mask today. So Made to Sleep also has these aroma dots, and they are, I'll just give you an example. So I'm going to place this in your mask, and I want you to tell me if you feel that it enhances your experience. So it looks just like this, very small circular disc. It's scented with eucalyptus. It smells quite relaxing in my opinion. So I'm going to place that in your mask, and that should help, especially with that headache you've been feeling. So let me just adjust your mask. The fabric on this one is very nice and luxurious, very soft on the inside, not abrasive to the skin at all. And the tapered eye cups allow for just a comfortable fit overall around the eyes, so don't have to worry about it, you know, damaging your lashes or putting too much pressure on your eye, which I know you were concerned about. So we did need about a 3/4 inch space. So I'm just going to adjust the Velcro here, make sure that they fit you appropriately. 3/4 inch at the center. And then from here we need about 1 3/4, so that actually looks okay. And this side, that looks okay as well. All right. Okay. So let's go ahead and place this on your eyes. I want you to just close your eyes and relax for me. I'm going to place this directly over your face. You're immediately going to feel the relief, the weight of the mask. Now I want you to tell me just, you know, from initial feel, does that feel okay? Do you like the weight of the mask itself?
Yes.
Okay. Have you turn your head here just slightly for me. I just want to see, I'm going to feel around and make sure that that feels okay. I do think we got a good fit. Your measurements look okay. So all of Manta Sleep's eye masks have a blackout feature that allows for any light to not be able to penetrate through the mask. So I would like to test that out to ensure that we did in fact get a good fit. So I'm going to shine a light here at the top and bottom, and I'd just like you to indicate to me if you should see any light. At this point you shouldn't be able to see any light. Okay, and if there are any areas where light is peeking through, we can obviously adjust, but I do think that's okay. I don't see any light shining from the top to the bottom. All right. And does that fabric feel okay? Okay, good.
Very soft.
It is very soft. Good. Okay. All right. All right, Maddie. So I am going to begin your sleep session. So I will set a timer for 30 minutes. I'd like you to just relax comfortably. If at any point you need me, you are welcome to use your call light. And if not, I will come back. And then at that point, we can proceed with your scalp examination.
Okay.
All right. All right, Miss Maddie. It's been about 30 minutes. I don't want to startle you, but it is time to proceed with your scalp examination today. So I'm going to go ahead and take this mask off of you. I'll ask that you just lift your head gently for me so we can just attach there. And then there might be a bit of an adjustment as we kind of reintroduce light there. So I'll give you just a second. Does that feel okay? Do you feel any relief of tenderness from the temporal region there?
Oh yeah.
Good. Okay, very good. So as I stated, I think the fitted mask would be the best fit for you. I also think that eucalyptus aroma dot was quite nice. Give you a little bit of aromatherapy there. So I'm just going to palpate the area briefly. Now I will be sending you home with this mask today, and if you'd like to purchase anything else from Manta Sleep, you can do so via the link in my description box or in the pinned comment. Be sure to use code SIESTA for 10% off. And as always, we'd like to thank Manta Sleep for sponsoring this portion of today's video. So as we proceed with your scalp examination, I'd like you to tell me first if you're just experiencing any tenderness of the cranium here.
Just a little bit.
Just a little bit. Okay, all right. So I will be mindful of that. You are welcome to go ahead and relax. This is going to be a more passive examination on your part. I will be just kind of observing, performing some different tests, and just gathering information about your scalp health as a whole. Okay? All right, Maddie. So let me know if you need anything. I'm going to begin by placing on a pair of gloves while we start our preliminary assessment. I'm going to come in first, just performing a soft palpation of the area. So just feeling the head in its entirety, feeling for any abnormal lumps or bumps, any nodules or something that feels concerning. So far that feels okay. Of course, if at any point anything is tender, please do let me know. Just a very small manipulation here at the hairline. That feels okay. Okay, just remove your hair. Just having a look around the ear and the external skin here. Looks okay. Your skin is very clear, very even in complexion, which is a good sign. Just working directly along the mastoid process. Any pain or tenderness there, Maddie?
Mm-mm.
Good. Okay. All right. So just gonna feel just quickly around the brow bone. Just gonna have you turn your head slightly there for me. Perfect. Not noting any edema along the brow bone. It feels okay. Okay. So just gonna have a look in the hair itself. You have very beautiful hair, nice and thick, very full. Not noting any signs of abnormal baldness or any signs of alopecia. No traction alopecia noted at the hairline, which is fairly common in women, but I don't see that here. Your hair is very full, nice and thick, very even in texture. Now, it does appear as if your hair is heat treated. Would you say that your natural texture is fairly similar to what I'm seeing today? Okay, good. All right. So I'm not seeing any areas of open wound or anything that looks particularly concerning. Just like to make sure before we proceed with the rest of our examination, but that does look okay. Not seeing any real signs of flaking or discoloration. Just going to look at the hair itself, obviously looking for any signs of infestation or anything like that, but there's no, lice or mites or anything noticed there, so of course that's good news. You do have a very small mole here, so we'll have a look at that. Okay. I've got a pair of loops here. I'm just going to put these on so I can have a closer look at this mole. Okay, so it's very small. I'm actually going to take a quick measurement here. It's only about 1.5 centimeters in width. And about the same in length, closer to 1 centimeter there. So 1.5 by 1. Okay, so I will document that later. Just keep that in mind. It is rather hard to do skin checks on our own scalp, obviously, as you're unable to see. So I am noticing just a little bit of pinkening here at your part. Do you tend to part your hair directly in the middle? Okay. So that obviously is common. We tend to favor either parting on the side or parting down the middle. Now I will say I do see just a little bit of pinkening there, which is just a mild sunburn. So if you've been spending some time outside, that makes perfect sense. Not a whole lot you can do to accommodate that, obviously, if the way you style your hair is, typically parted down the middle. They do have spray sunscreen that could be an option, maybe just a light spray just to make sure you're protecting your scalp. Something to keep in mind, but it really isn't too bad, just mild. Maybe something I would consider for longer days outside if you frequent theme parks or festivals or something like that, but otherwise I think you're okay there. All right. Very light manipulation of the hair here. Let me know if that causes you any discomfort. I'm doing a very mild tug test, just checking for strength and integrity of the hair follicles. So this allows me to feel for any weakening of the hair shaft. That looks okay. Certainly not noticing any gumminess or protein deficiency of the hair itself is very strong. That's good. All right. I'm going to go ahead and take my gloves off because I don't see anything that could be contagious or harmful for either one of us. And we can proceed further in the examination. So go ahead and relax for me. I'm going to use my hair sticks here to just have a bit of a look, close in on some sections of the scalp. Overall scalp health appears to be intact. I don't notice any signs of dandruff. There's no, seborrheic dermatitis. I don't see any flaking. No other moles notable, so that one there is likely caused by skin exposure. Hair color is consistent throughout. I don't notice any graying. You do have some highlights in your hair. Is that natural, or do you get your hair color treated? It appears very natural to me.
Natural.
Okay. So you've got beautiful natural highlights. Okay. Just a small spoolie here. I'm going to use it to just brush over the very front portion of your hairline. Allows me to agitate the skin just a little bit and see if there's any dislodgement of flaky particles or any skin that is stuck to the surface, which so far is not notable. That looks good. So nothing is coming up even upon agitation, which is a good sign. Good indication that you are exfoliating appropriately, so that's great. Oftentimes we don't think about exfoliation of the scalp, but it is important to kind of get rid of any particles that may be stuck, especially with our hair. It's harder for a displacement of loose skin there, so that is very good. I'm just going to do the same along the hairline here, the part line rather. Good. I'm going with secondary tool here. Good. Okay. That looks okay. Just going to pick out a few specific strands of hair using my tweezers. I'm not obviously going to tweeze your hair, just gentle tug, testing again for follicle strength. Also allows me to look at individual hair strands. a tool here that is made of a natural stone. So this is a gemstone comb, and just allows me to feel for any abnormal texture of the skeletal system of the cranium here. So along your skeleton, along your scalp, if I feel any lumps or bumps, the kind of pointed edge here will allow me to feel anything that I might have missed with just my hands. So I'm just going to gently glide this along the scalp. You can let me know if I'm applying too much pressure. So far everything feels fairly smooth. Obviously there's always a bit of natural variation in texture. That does feel okay. I'm going to go right down the center. Just feel down to the back of the cranium there. That feels okay as well. So I'm going to have you turn your head this way for me, Maddie. Is that comfortable for you? Mm-hmm. Just doing a quick feel at the very base of the scalp here. Not feeling any abnormality there either. Okay. All right. Let's go ahead and center your head. That's good. Just doing a test for any smoothness. The hair itself, testing for abnormality in texture or any abnormal frizz, but I'm not noticing that, aside from just regular agitation. That does look okay. Do some pressure testing here, Maddie. You're going to feel some pressurized air. No notable abnormalities here, no signs of inflammation, especially around these more sparse exposed areas. That does look okay. Maddie, I'd like you to just tell me briefly, are you able to feel that okay? Mm-hmm. Can you feel this here? Mm-hmm. And down along, you feel that there? Mm-hmm. And does this side feel any different than that side?
Not really.
No, good. Okay. About the same. And here you can feel that as well. Does that feel any different than that side? Anywhere in your scalp, here, 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 does that all feel about the same? Good. Okay. Just making sure that you're not experiencing any neurological dysfunction, and that does look okay. So I'm going to apply pressure to your head, bilateral pressure here, so you'll feel me touch both sides. I want you to just tell me if either side feels different. So for example, here, the right side should feel slightly more pressure. Do you feel that? Okay. So do you feel any difference here?
Left.
Good. And here.
Right.
And here.
Left.
And here.
Right.
Good. Do you feel me pulling your hair equally on both sides? And now.
Right.
And now.
Left.
And now.
Same.
Very good. Okay, all of that looks great. All right, Maddie. That is going to conclude your examination today. Everything looks okay as far as your scalp and hair health. I also did a brief examination along the brows, and I didn't notice any abnormality there. So I think aside from the trouble that you've been having sleeping and with your headaches, everything as far as your scalp health is intact. Now, I would like to have you in for a reassessment in about 6 months or so. That way we can see if there's any major changes, as well as keep track of that mole that you have here, okay?
Okay.
All right. All right. Well, thank you for coming in today. I will allow you a few minutes, and I hope you get home safely.
Thank you.
Thank you.